I've decided to make this video because lately I've noticed in my hospital कि जो भी पेशेंट हमारे यहाँ एडमिट होते हैं लाइक रूटीन इन्वेस्टिगेशन में हम उनका अल्ट्रासाउंड कराते हैं, चाहे वो वार्ड में एडमिट हो रहे हो चाहे वो आईसीयू में एडमिट हो रहे हो. सो जब भी हम रिपोर्ट्स देखते हैं तो वी लुक फॉर सम सिग्निफिकेंट फाइंडिंग एंड मोस्ट ऑफ द रिपोर्ट्स हैव grade 1 or grade 2 fatty liver in it, and that is not the problem. The problem is when we see those reports we are like चलो आप नहीं, there is no significant finding, कोई खास प्रॉब्लम है नहीं आपको, खाली फैटी लिवर आया है, वो मोस्टली आजकल हर लोगों को होता है. So that in itself is a very alarming situation, that how we have reached a point in terms of lifestyle disease that we are normalizing fatty liver. Hello everyone, I am Dr. Ritik Duggar, and in this video I am going to talk about fatty liver. So the first question automatically comes is, what is fatty liver? So fatty liver is basically accumulation of different type of fats, triglycerides or other form of fats in the hepatocytes. So what is hepatocytes? Is the cells of liver, and when there is a disbalance between the delivery of fats to the hepatocytes and removal of fats from the liver, so it leads to gradual accumulation of fat in the liver, causing fatty liver. So earlier जो लोग अल्कोहल कंज्यूम करते थे उनमें फैटी लिवर देखा जाता था, एंड उनको यही एडवाइस करते थे कि आप अल्कोहल छोड़ दो एंड इट विल रिवर्स. But nowadays non-alcoholic fatty liver disease is increasing at such an alarming rate that the current global prevalence of non-alcoholic fatty liver disease is 25%. So alcoholic fatty liver disease was due to consumption of alcohol, क्योंकि alcohol metabolize होने के लिए liver में जाता था, and वहाँ पर due to excess मतलब बाय प्रोडक्ट ऑफ अल्कोहल it leads to accumulation of fat. But nowadays the lifestyle which we all have, that sedentary lifestyle where we do not exercise much and at the same time we consume a lot of junk foods, processed foods, packed foods with lot of highly saturated fats, rich in cholesterol. We consume a lot of packaged drinks which have a lot of sugar in it, is causing the accumulation of fat in liver. Non-alcoholic fatty liver is a lifestyle disease. In fact, the prevalence of non-alcoholic fatty liver disease is even higher in patients who have other lifestyle diseases, like overweight patients have almost 65% prevalence of non-alcoholic fatty liver disease, whereas obese people have almost 90% prevalence of fatty liver disease, and while patients suffering from type 2 diabetes mellitus have 70% of non-alcoholic fatty liver disease. And the problem with non-alcoholic fatty liver disease is like it is increasing like a silent epidemic, because it is not having acute symptom. So जो initial stages of fatty liver grade 1, grade 2, grade 3 में we do not have any symptoms as such. So हमें पता भी नहीं चलता है, हमें भी लगता है कि कोई प्रॉब्लम है नहीं. And most of the people are not even aware that it is as dangerous as alcoholic liver disease. ठीक है, अगर कोई इंसान अल्कोहल पीता है, we warn them तुरंत कि यार तुम्हारा लिवर खराब हो जाएगा. But do we tell the same thing to the person who is overweight or the person who has very unhealthy lifestyle? No, it is as dangerous as alcoholic fatty liver disease. Patient with non-alcoholic fatty liver can develop steatohepatitis, liver failure or cirrhosis, and so much so that they may need liver transplant. So the purpose of this video is to create awareness and to share some basic tips which will help you to prevent fatty liver or to cure early stages fatty liver disease. So the first most important point is healthy diet. So you need to avoid as much as packed food or processed food or junk food. I know जैसा हमारे lifestyle है, जिस तरीके से हम mostly अगर young people की बात करें तो most of the time they eat outside. So it's not possible all the time, but make sure you avoid as much as possible all these junk foods, processed food, packed food, and at the same time focus on adding whole foods to your diet. Limit adding sugar. Many general people associate sugar with diabetes, but sugar is as much as associated with fatty liver disease also. Do not eat fried food, and even if you eat fried food, do not eat from the oil which are heated multiple times, because that leads to accumulation of trans fat. So that is very unhealthy. So eat healthy quality of fats, take it, control portion size, drink as much water as you can, and of course avoid alcohol as much as you can, because if you combine both of them together, like you are consuming alcohol at the same time you have a very bad lifestyle, so it will progress even faster. The second important point is exercise regularly. At least try to find out 30 to 45 minutes at least 5 days a week. Third very important point is weight management. So try eating right food and try to exercise timely so that you will be able to manage your weight. So it's not possible all the time to eat healthy food, because most of us are very busy, we have a very hectic schedule, and most of us are living in hostels, PGs, or are alone. So we do not get time to eat the fresh cooked home food or whole foods or fresh vegetables and salads. That's when you can use supplements which will help you in digestion, which will help you to reduce inflammatory state of the body. And I found this amazing product from Fytika, that is Fit Liver. So it basically helps you to improve your digestion. It detoxifies all the toxin, and which is a function of liver. So it aids in the function of the liver, and it has also have a lot of anti-inflammatory properties. It contains all these natural ingredients. I'll add the list of ingredients here. If all the ingredients are natural, there is no such side effect. So you can take 2 tablets a day, especially post-meal, so that it will aid in your digestion. So especially pregnant and lactating women must consult their doctor before consuming any such supplement. I wish you all a very happy and healthy life, and all of us are together in this. Like, we all are trying to eat healthy at our capacity, or we all are trying to improve our lifestyle choices. So thank you for watching. If you like my video, like, share and subscribe to my channel. Thank you for watching.